Part 3. So I walk into the room, I wash my hands. Hey, Mr. O, my name is Nate Emmons. I'm going to be your student nurse for today. How you doing? He tells me that he's having a little bit of belly pain. Yeah, Ben told me that at shift change that he noticed that you had a black tarry stool, um, and that you have some abdominal pain. Are you still having that? He says yes. Can I see your wristband for a minute? Can you tell me your first and last name? He goes ahead and gives me his first and last name. Are you allergic to anything? He states that he has no allergies. So I go ahead and I attain the blood pressure at this time, and I find that his blood pressure is to be 94/66. I check his pulse, and he has a pulse of 114. I'm going to go ahead and sit him up. I'm going to go ahead and listen to your back here. So I'm listening, and I listen to the front. His lung sounds are clear. His respiratory rate is 24. He's on the monitor, and I look, and he has an O2 saturation of 97%. As I'm touching his arm, I notice that he has pale and clammy skin. He's a little bit diaphoretic. Sir, I'm going to go ahead and pull your shirt up here a little bit. I'm going to look at your belly. I'm looking, and I notice that he has belly distension, so I'm not going to go ahead and palpate or anything like that. I'm going to go ahead and listen. I listen to his belly, and I notice that he has normal sounds in his belly in all four quadrants, and they're active. Can you go ahead on, is your belly hurting at all? And he tells me that his belly is hurting. Can you, on a scale of 1 to 10, 10 being the worst pain you ever felt, can you tell me what it's at right now? He goes and tells me that it's at a 6. When you got up to go to the bathroom, did you feel dizzy at all or lightheadedness? He tells me that he did feel lightheadedness and some dizziness. All right, Mr. O, what I'm going to do is I'm going to go ahead and notify the doctor of what's going on. We'll go ahead and we'll get you something for that belly pain and get that taken care of so you have a little bit of ease. As of right now, we're not going to do any more NSAIDs or any more of the like aspirin and Tylenol and things like that are that you have been taking for your back pain. I'm going to go ahead and talk to the doctor and see if he wants you to discontinue that. And then just try to get you comfortable. Are you more comfortable sitting up like this? He tells me, yeah. Well, I'm going to give you the call light here. If you need to get up and use the bathroom at all, if you feel like you got to go to the bathroom at all anymore, what I want you to do is go ahead and go to the bathroom. Just leave it in that hat, though. Don't flush it. And go ahead and call, and we'll help you get to the bathroom, okay? I don't want you to fall or anything like that. And then, like I said, we'll go ahead and get you something for that belly pain and that. Do you have any questions for me right now? He tells me he doesn't have any questions. Ma'am, do you have any questions for me? His wife doesn't have any questions for me right now. All right, well, I'm going to go call the doctor, and we'll get this taken care of, okay? And try to get you more comfortable. I go ahead and wash my hands, and I leave the room. On the scenario, on the clinical scenario, I think it's really good. The question that I would have is, I would like to get a little bit more health history, and find out kind of like, does he have a history of ulcers? Does he have any, I don't know, maybe some diverticulitis or something? I wish it was just a little bit more in depth, and that's something through the nursing process and through obtaining a health history and doing a focused assessment that I would really be able to gain information and knowledge from. Also from his wife, I would be able to gain some data from her too, and just kind of find out more of a background of what's going on, and things like that. Has he ever had black tarry stools before? Is this the first time? Things like that. As far as other things, I would make sure that we would note that he is a fall risk, and I would want to obtain some type of on-call to make sure, send it to the lab and make sure that it is blood in the stool, because that's what we're leaning towards. The last part is I would just make sure that I was very thorough in the SBAR report when I give it to the doctor, and we'll go through that. And I would want to make sure that if I have any questions that I ask, even though I know that it needs to be a process that's basically just quick and to the point.